Assalamualaikum. My name is Nur Nabila binti Maswan and my metric number is 190353. Today, we will present about awareness of COVID-19. Coronavirus disease, aka COVID-19, is a contagious infection. The cause of the disease is still not identified. The easiest way to delay the spread of the COVID-19 virus is educate yourself about the virus, the illness, its causes, and how well it spread. Protect ourselves and others from illness by constantly washing our hands or using an alcohol-based rub and not rubbing our face. Among the signs of COVID-19 infection is that the patient will have a mild respiratory infection and will recover without the need for special treatment. People over the age of 65 as well as those with pre-existing medical conditions such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer tend to have serious illnesses. When an infection person coughs or sneezes, the COVID-19 virus spreads mainly by droplets of saliva or discharge from the nose. So it is important that we all exercise respiratory etiquette. For example, coughing into flexes elbow just like like that. The spread of COVID-19 infection as a result of insensitivity and stubbornness of the community causes cases to increase day by day. Here, I also include a news that showing the increasingly daily case. Malaysia daily case from around 5,000 to 9,000 cases as expected to reach 10,000. This is make worries if tsunami COVID-19 will hit Malaysia. To seek community awareness, we conducted two survey on UTHM student and close acquaintance. We create a Google form and then spread via WhatsApp status. With this, we can get respondent in large number and quickly without having to face. Based on our survey, we got 61 respondents that answer all questions. On that Google form, we prepare 10 questions. The question 1 is, do you follow current issue regarding this COVID-19 either in our country or abroad? Majority of the respondent current issue of COVID-19. From graph, 24 respondent give scale 5, 21 give scale 4, 15 give scale 3, and only 1 give scale 2. So thankfully, no one gives scale 1. Question number 2. Are we aware that COVID-19 in our country is still under control? To other countries, like what happened in India recently where the number of people infection with COVID-19 has doubled. Based on pie chart, 72.1% respondent aware, whilst 27.9% respondent not aware. Question number 3. Do you agree with the government to carry out the Movement Control Order 3.0 during the Hari Raya Idul Fitri season? Based on pie chart, 78.7% aware, while 21.3% not aware. For the next question, I'll pass to the next member. Oh yeah, don't forget to wear mask.
Assalamualaikum and hi, my name is Nurul Fatihah binti Mak Fauzi, AA191853. Thank you Nabila. Now it's my turn to talk about the Standard Operating Procedure, also called as a SOP, compound and facility or health infrastructure in Malaysia. As a Malaysian, do you comply with the SOP provided by the government to curb the spread of COVID-19? From our data, 98.4% still want to follow the SOP because of the trust that the new variants from South African and Indian are very dangerous and easily infected. For now, people must wear masks 1 meter apart, use hand sanitizer, no hug, no handshake, temperature check, and the most important is scan My Sejahtera or write name before inside the shop. The next question is, should a compound be imposed on offenders? We also ask what is the suitable value of the compound that should be imposed on people who break the rules. Based on the pie, 42% agreed to impose a compound less than only 500 ringgit for the first offence, 33% to charge 1,000 ringgit. But some of our respondents suggest to only 10 to 20% from the salary. 8.2% say no to the compound because the value of compound is too much, not all people have money, the compound is unfair, and other than that, they ask to get warning first for first offence and then compound to the pupil according to the salary. As we know, COVID-19 patients are on the rise day by day after Hari Raya celebration. So, the question is, does Malaysia have enough hospital facility or health infrastructure to treat the patient? Based on the pie, 67.2% say yes and the others say no. If ask me personally, I will say yes because the government want the best for the Malaysian. Last question, how are government preparation to ensure facilities in hospital to accommodate COVID-19 patient? Mostly our respondent rate 4/5 for the facilities. For me, I am very satisfied with the preparation to accommodate COVID-19 patient. Based on the article Sinar Harian, 95 private hospital agreed to treat COVID-19 patient. Last but not least, please stay at home as much as possible. Only leave if extremely as necessary. And seek medical care if you are cough, have difficult breath and fever. That's all from me. Thank you.
Assalamualaikum. My name is Nur Ainaja binti Edi Muhammad. My matric number is AA191816. So now I will continue to the next question that we asked to our respondent. So the question is, we asked them either they are agree or not if vaccination is mandatory to all Malaysian. So the result that we get from our survey is 91.8% people agree if all Malaysians get vaccinated, and only 8.2% people are not agree if all Malaysians get vaccinated. Alright, so here is the data of people that has been registered to get a vaccine. Until 28 May 2021, there are almost 11,564,724 people has been registered. The number of people registered to get a vaccine keep increasing day by day. So it shows the campaign that government do to spread the awareness that vaccine is important to us, to break the chain is positive effect. So it means the Malaysian has been realized that vaccination is very important to us to protect other people and to break the chains of COVID-19 in our country. Why vaccine is important to us? It is because vaccine can help to reduce the risk of critical symptoms if we get infected with COVID-19. For example, if the people that already vaccinated and they get infected with COVID-19, they maybe just have a mild symptom, maybe just like flu and cough. Besides, we already know that there are a lot of articles shows that the people that already vaccinated and they get infected with COVID-19 have low risk to infecting to other people. So with the vaccine, it helps to break the chains of COVID-19. Next is the benefit of getting the vaccine. So the first one is we can prevent from getting very ill. Like I said before, the person that have been vaccinated and they get infected with COVID-19 will have a mild symptom. And next is protect others. where if we have vaccinated, we have the low risk to infecting to other people. So it helps to spread the to break the chains of COVID-19. The third one is to boost our immune system. If our immune system is increased, it helps to fight the virus that we expose, especially COVID-19 virus. So the last is we can stop the spread of COVID-19. It means we can break the chains of COVID-19 and we can live like a normal life like before pandemic COVID-19 come to our life. Okay, next is the 3 reasons why people are not getting the vaccine. So the first one is because the vaccine do not stop the transmission or infection. The second one is underreporting of adverse reaction and deaths. And the third one is already had COVID. Alright, the next question that we asked to our respondent is, have them vaccinated? So the result that we get from our survey is 98.4% people are not vaccinated yet. As we know that in Malaysia, our government have divided the phase to get the vaccine because they give the vaccine to the people who have a high risk to get infected with COVID-19. So the last question that we asked in our survey is, we asked them to give opinion to curb the spread of COVID-19. So here is the common answer that we get. The first one is people should stop blaming other people because there are a few people that keep blaming other people because they don't want to follow SOP that MKN provide. We should care ourselves and family so that we can protect each other and we can break the chain of COVID-19. The second one is mandate vaccination for everyone and make something exclusive for people who have been vaccinated. Maybe they should have a badge or anything that symbols that anything that we can identify that the people have been vaccinated. And the third one is our government should provide online school system because it's almost 1 year students keep learning during online classes, so they should have online system that more systematic and it can help all students to learn better even in online class. Next is for the new student who want to register, maybe they can register just through online, so it's more easier. And next, government should have a system and plan to the people who has lab season, MUAT and final exam, so that they still can do their work even during online or even in this pandemic. Okay, so the fourth opinion is the government should review the appropriate way to control this COVID-19 because we can see that now the cases in our country is keep increasing. So the government should have a appropriate way to control to break the chains of COVID-19 in our country. And then the people must be complying with the SOP that have been provided for us, which is we need to wear masks, we need to have a social distancing and keep washing our hands. And the last is all Malaysians should follow the SOP that already provided by the MKN and WHO, no matter who are you, because we together need to help each other to break the chains of COVID-19 in our country. All Malaysians should follow the SOP no matter who are you. No matter you are artist or you are minister, you should follow the SOP that provided. We need each other to stop the spread of COVID-19 virus in our country. So to all the Malaysian, we should help each other and please don't selfish. The last opinion that our respondent give is government should have a lockdown to stop the spread of COVID-19 in our country. So the conclusion is COVID-19 is a really serious virus. So we should have a responsibility to break the chains of COVID-19 in our country. So we should follow the SOP that MKM provide to us, which is we need to wear masks, we need to have a social distancing, and we need to wash our hand frequently. As we know that our minister already announced that we are going to have another lockdown started with 1 June. So I hope that everyone stay at home, always wash your hand, use mask if you want to go out, and don't forget to bring your sanitizer whenever you go. That's all from me. Thank you.